Good evening, everybody. Welcome to the Carolina Theater. If you've been to an Anita Woodley production, you know that there is some interaction involved. So if I say, good evening, everybody, yes, now you are warmed up. Let me welcome you on behalf of FHI 360 and Anita Woodley Productions to this debut performance of Bucking the Medical and Mental Bull. My name is Emily Namey, if I didn't say that before. I am with FHI 360, and if you read in the program, this is a unique show in that it's based on data that we collected from public health research over the past 18 months or so. And so I'd like to give you just a little bit of background on that research so that you have the right context to listen to what and experience what you're going to experience in the next hour or so. So first of all, for those of you who might not be familiar, FHI 360 is a nonprofit human development organization. We work in over 70 countries around the world, doing everything from nutrition, health, economic development, education. And though most of our work is overseas, we're headquartered right down the road at the American Tobacco District. So we have a strong U.S. portfolio, and we have a growing number of projects right here in the Triangle. And we're really excited about that because we get to then bring our skills to some local issues. And the Durham Focus Group Project, on which this show is based, is one of those examples. So in 2012, Dr. Greg Guest, who is a research methods expert at FHI, he was awarded a grant from the Patient-Centered Outcomes Research Institute, or PCORI for short. So as the name implies, they're interested in doing research on patient-centered outcomes. And so what we were awarded to do, well, there were two objectives. The first was to look at what are the most effective ways to collect information on patients' experiences and views of health and healthcare. So that was objective one. It was really methods related, and lucky for you, it's not what the show is about tonight. So what we'll be focusing on is objective two. And PCORI is also very interested in looking at health disparities and in funding research that is producing evidence that can help to reduce those disparities. And if you look at the health disparities statistics across the state of North Carolina, African Americans bear a disproportionate burden from those. So we decided that our research topic would have to do with African American health in the city of Durham, and we decided to consult the community on what would be a really relevant and useful research topic around that. So we held some preliminary focus groups, and we asked, what are all of the most pressing health problems affecting the African American community here in Durham? And we got a whole list of diseases and conditions, and when we looked across those, part of what we noticed is that many of those were preventable, screenable, or treatable. And so when we asked questions about that, there was this sort of repeated narrative that there's a segment of the population that cannot access, will not access, or does not want to access healthcare, even though we're here in the city of Madison. So we thought that would be a great opportunity to explore that a little further. As you saw out in the lobby before the show started, there are so many organizations doing great work here in Durham. And so we wanted to find out more from these men in particular, because the quote of those focus groups was, "Black men just don't go to the doctor." And so the topic of the research became about African American men's health-seeking behavior. We conducted 40 focus groups and 40 in-depth interviews with about 360 African American men. And we asked them about their healthcare experiences, the good, the bad, and the ugly. We asked them what motivates them to go to the doctor, what prevents them from seeking care when they need it. And so if any of you in the audience were part of those focus groups, I want to say a tremendous thank you to you. I conducted all of those focus groups and interviews. I asked the same questions 80 times, and I never got bored. These guys had a lot to say. They were full of emotion. They shared their opinions, their experiences. And as we were listening to all of this, there was so much richness. There was such a dynamic discussion going on that there was no one view, that was for sure. And so it was going to be very difficult to capture that in some kind of written report, which of course we will still do that. But not only that, we felt we wanted to be able to make the research findings accessible to the population here in the community, and also engage the public health community, the healthcare service providers, so that everybody was hearing the same information at the same time, and we could have a discussion about it. And so thinking about that, our colleague on our research team, Jamila Taylor, had learned about ethnodrama. Ethnodrama is the idea that you use performing arts to make research findings accessible. And soon after we had started thinking about this, another colleague alerted us that Anita Woodley was going to be at a meeting of the Partnership for a Healthy Durham. So we went to that meeting. We saw Anita perform just a snippet of what she can do, and we thought, yep, this could really work. So that was over the summer, I believe, and we've been working with Anita for several months now. We were able to share some of the audio recordings from the focus group so she could get the feeling for the questions I asked, how I asked them, how the men responded. We also shared some written transcripts, some preliminary analysis that our team had done. So thank you to Kevin McKenna and Natalie Ely for working on that, along with Jamila Taylor. We also gave her a list of some of the key themes, some of the findings that we wanted to make sure were incorporated into the play. And so she has done a tremendous job of wading through a lot of information and creating some composite characters. So everything you hear tonight is based on data, and not any one person, though. So it's all drawn from the range of experiences and opinions that were expressed. And we think that it highlights all of the highlights of what we found in the data. Thank you so much for coming to support this production, and I will bring on Anita Woodley and Bucking the Medical and Mental Bull. Thank you so much, and enjoy the show.
Hello. Welcome. Today is October 28th, and this is our final focus group about African American males sharing their experiences with the healthcare system in Durham, North Carolina. The men have agreed to participate in this study, and we thank you for agreeing to witness this group. I'm a researcher from FHI 360, and I will be facilitating the group. I'm going to ask some questions of the men that they can answer on an individual level or on a community level. And we'll go right here in the group, and it's pretty simple. They'll tell us how long they've lived in Durham and whether they have seen a physician in the last year for any reason, and I don't need the reason. And usually we start by them saying a number that they're assigned for their anonymity. And basically, we're not going to do that this time. We're going to switch it up a little bit, and we're going to have them use the first name of their favorite musician. And then after that, we are going to have them say the genre of music that they like that musician does. And that will help us identify who the guys are. And we also will have a lady floating around capturing the gestures of the group. So just so you know that that's happening. She's Barbara from Arts Images Live. So we're just going to have that, she's in the background there. And I guess we'll just go ahead and get started. I guess the first guy can go.
My name is Conscious Rap. First of all, I want to say thank you for not marginalizing us as black men. I want to say thank you for saying that you ain't going to give us a number. I appreciate that. Because thank you. Yeah. Because pretty much, they give you that little number there and it's like you a statistic, but, that's not how I roll. I've been in Durham for about 35 years on and off, you feel me? And, here or there. And have I seen healthcare? No. When is the last time that I seen healthcare? It was years ago when I was incarcerated.
My name is Miles Jazz, and I've been living in Durham for 3.5 years now. And have I seen the physician? Yes, of course.
My name is BB Blues, as in BB the Blues King. And I'm 61 years old, and I've been living in Durham for about 61 years, that'd be right. And I'm born here, and I didn't think the doctor somewhere down the street.
In the last few months, I go, on the count of my leg.
My name is Luther R&B. You know, the Luther. Doom 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 doom. Oh, ooh. Yeah, And I've been in Durham for about 6.5 years. Yeah, I would say it's been about 6.5 years, so I'm, happy about that. And I go to the primary physician every now and then. Sometimes she has me come every other month. You wanted to know the last time? Last time was like every other month ago, right? And yeah, and basically she every other month, and then she wanted to see about my health issue with, you didn't want to know the health issue. I'm just eager to be here.
Well, thank you. Thank you. Thank you. So I'm just going to move on to the next question. And that was sort of a warm-up question. And now the next question is, what do you think are the most common types of health problems in the African American community? Share some of your experiences with us.
Well, I would say high blood pressure and cancer. Yeah, see, when it comes to cancer, it runs in my family. Sometimes we go and check it out. Sometimes we don't. Those that didn't, they're not here anymore. It's just one of those things. It just, goes how it goes. My dad, he had a prostate cancer, and he's doing well. It wasn't rare. My uncles, it's just a long story, but you didn't ask all of that. Thank you.
I used to love eating Kool-Aid, like eating it. You know what I'm saying? And my eating habits was real bad. They was real bad when I was a kid. So basically, I had an aunt O.M. I called her O.M. because she was my other mother. So while my mama was working, she took care of me, and she make these meals that you eat, and it just fill you up, right? To where you feel like you about to explode. And it was just like so good, you want to go to sleep. It was that kind of food that make you just fall asleep and dream about it. I mean, that good, greasy food that slide down your throat, right?
Yeah, I know what you're talking about. And the Kool-Aid. Oh, yeah, that was so good. Come over here and show us what to do with it. Let's show it. See, because I had the Kool-Aid, and I lost my leg because of the sugar. Not this sugar. Well, it was this sugar. But because of the sugar, see, I was in the war. And when I was in the war, it wasn't the war that took my legs, but it was the sugar. You feel me? Okay, don't touch me. Yeah, so the sugar is what did it, but I'm interested. Come on over here, young man. Show me what you used to do. This is some good old-time stuff. This is the old-time stuff.
All right, so what did it look? Back up some.
Okay. Back up. I can't see nothing from over here. Come over here.
Okay, stand right here. All right, here we go. I'm about to make this, all right? So basically, my aunt O.M., she would just make the Kool-Aid where you just, get your picture. Not this one, but that's how I say it. Not the picture, but you feel me? All right. Put some cold water in it. That's enough to get the party started. Then you got to put sugar in it. It's the best part. This 4 pounds of sugar. I just bought it, and it works. So you want to put a cup in. That's how she started. We might get ants. I'm sorry about that. Put 1 cup in. Wait a minute. Do they got any instruction? No. Oh, I know how to make it. All right, you put.
Did you put it? Let me help. Did you put it? I'm gonna hold it.
All right, man. Look, you hold it. Man, you can't hold it, man. Get the damn cup, man. Man, BB, man, be still. Making me nervous. I ain't never cooked it in front of people. All right, I'm almost there, y'all. You got to be patient. I got to taste it with my long spoon. That ain't enough sugar. Then when it get like that, don't worry. You just got to pour some water out. Put more sugar in. Little more water out, little more water out. Usually you buy a sink so you won't have this problem. There you go. That's 4 pounds. That should be right. Stir it around. You make sure it come off the bottom. Yeah, this look like milk. This is it. Then you get your pack of cuckoo. This spritz called red. Why you looking like you need a flavor? It's called red, man. You got red, purple. This is red. So put your red in. Stir it. There you go. Now that's cooking. Yeah. Oh, man, this stuff's so good. Wait a minute. I don't even have to taste it. I know what's up. Y'all know y'all like that. Don't act like y'all ain't ate it like this. Yeah. Oh, yeah. It's like, oh, yeah. Keep it up, beep it up, beep it. Yeah. It's all right. Yeah. Oh, hey. Oh, yeah. Skip it a beep it a beep it. Yeah. It's all right. Yeah. Having a party. Then on the radio. Bad boy.
Yeah, you sure is bad. You bad. Wait, let me get some. I got the sugar. I can't do it. I wish I could, but I can't do it. Listen, I'm just licking. Thank you. You know, see that I got to stay away from the sugar because with the sugar, it's put in a bad situation with my leg. Like I said, it came off, but you know, I can't act like I didn't know that that's what was going to happen because the doctors tried to warn me that that was the issue, but I didn't care because it tastes so good. So I did it anyway because it tastes so good. That looked too good over there.
Yeah, I would say liver problems, diabetes. He already said diabetes. Liver problem, kidney problem, HIV, high blood pressure.
Are you gonna leave any for me to say?
High blood pressure, HIV, cholesterol, anything, you name it, that's in the black community. But see, the thing is in the black community, they don't really, can I keep it real? They the reason they got their own problems, man. They don't even care. They don't even take care of their health. I'm just going to be honest. I can't even sit here and lie. I don't care if it's white people here looking at me. I got to tell the truth. I mean, that's why we here, right? So it's like this. They don't go to the doctor. And in our community, we do not talk about what we going through. So with our health issues, don't nobody say nothing. Then, you know, like if it's, say they leg broke like BB. I'm sorry, BB. But say they leg broke. And you see them sitting there like this with one leg, right? And you walk over and you say, what's wrong with your leg? What's the story behind that? And then they ain't going to tell you nothing. They don't want to talk about their health issues. Since they don't want to talk about their health issues, then you don't get to know. So then what they basically say is, I got the sugar. What the hell that mean? I got sugar in my cabinet. I put sugar in my coffee. But do that mean that my damn leg gonna get cut off? Now, they got to be clear, man. Stop all that little cute stuff. You know what I'm saying? That you got sugar, it sound too damn cute. That's like saying, oh, give me some sugar. No, man, that's real right there. You know what I'm saying? They don't want to say nothing about it, man. They just be pissing me off. We need to get real about our whole little situation. You know what I'm saying? We need to just get that out.
Well, are you done? I think we've got it. I would say high cholesterol, and I already said that, so I guess I'll say gout.
He must have been watching TV late at night or something talking about gout. That's crazy as hell talking about gout.
Okay. All right. Thank you. That was very, very informative. Okay. We're going to move to another question. And we'll imagine that I've moved here from another country. I've never interacted with the medical community here before. I'm new. So, from the moment that you walk into the door and until you leave, what's a typical visit like here in Durham, going to the doctors?
So for me, when I go to the doctors, it was hard at first because I ain't used to nobody asking me all them damn questions. All these questions. Then I heard them asking the lady when the last time she had a period. Why is that their business? I
I don't know. So I fill out all the papers. Then I have to wait real long in the line. What they don't understand is that it's hard for a man to come to the doctor. So because I'm here, you need to put me first on the list. It's America. I have arrived. Move me to the front. That's automatic, right? That's what I was thinking. And so, it got a little easier as time went on because I got a lot of easier. First with my leg, I would want a second and third and 10th opinion. And they told me that my non-health insurance don't really give me all that leeway. So, now it's pretty easy. It's pretty easy now. It's not that hard for me. It's not that hard.
Well, a typical doctor visit for me, it's pretty easy. I inform my supervisor that I'm
Not coming in.
but I do it ahead of time. And after I inform them of that, then I make my appointment, not before, because, see, I might not get the day off, and therefore I'm wasting their time and my time. And then after that, I get my test, and then I go back and I get my results. And after I get my results, I make another appointment.
You got it good.
Well, Luther, it's not a typical doctor visit ever. Not really, because when I go to the doctors, then I ask them to get my information. But see, I'm houseless. I got this situation. It's kind of like homeless, but I just hop from my little house, which is a box, from that house to this house. And what I would say is it's difficult because I have to bring all my papers. Now, my file is this big, and I bring the whole file, plus my x-rays, my dental work, everything, my prescription papers. So I walk in as if I'm an attorney. And then I walk in. So it's hard for me because I have to carry all this information around.
Well, that's easy for you because ain't none of my office visits typical. Man, only time I see a doctor is when I go to jail. Yeah, it's free. Soon as you walk in, cavity search, cough, pee on this, rub us in your mouth, got HIV, this and that. They put you in that unit if you got it. They put you over here if you don't. It's real easy. That's the last time I've seen them. Because, the doctors and stuff, they don't really care. They don't. They look at me, and then they just say, oh, he just nothing. He's an ex-con. He's a substance abuser. He's this, he's that. They don't really understand how I am, and I come in there. It just ain't right. I just don't like the way it feel when I go in there. I don't like the way it feel. And then, wait a minute. They got all these doctors that come in there. I'll tell y'all about that a little later, but I thought it was one doctor I came here to see. It's 15 of them in there.
Thank you. All right. All right. Does anybody want to add anything else at all? Anybody want to add anything? Because the question was, what's a typical doctor visit like? And I'm looking for just a little more information. Okay.
Oh, you want some information? I got some information. See, I went to Lincoln Center. They want $20 for a damn, they called it something fancy like a copay. So that means you pay before you get something done. That wasn't there before. That copay got me messed up.
Well, no, I don't think they had a copay no more, Conscious. The copay is gone.
No, it ain't gone, man. I know I seen it.
Well, no, man, I think they removed it. It was too many complaints. When was the last time you was there?
Man, I was there last week, man.
But I know they removed it. Have y'all seen the copay? Oh, y'all seen the copay?
Yeah, like I said, I didn't seen the damn copay. I know that it costs $20. But see, that's the thing. Everybody ain't got $20 damn dollars. And so when I want to go in, you got a form for people that ain't got $20? See, for me, it's real hard. That's why I don't trust people. That's why I can do my own medical stuff. I don't need nobody doing no medical stuff for me. I can take care of myself. I got this right here. I got this. I can do whatever I need to do. See, it all started for me when I was a little kid. Some people say you can't remember all the way back. But I remember all the way back when I was like real little, man. I remember how I would sit in my room, man. My mama put me down in the crib, man. I could see her. She put me down. And I remember I was hungry as hell. But she gonna put me in the bed hungry. Who do that? Can't even sleep right, bed too small. And I'm a toddler, man, and I'm trying to cry. Nothing happened. Reach my hands out, nothing happened. I can go even further back to when I was like 1 or 2, like 2 months. I remember being some attention, man. I wanted it. Nothing. A damn toddler. Kids need to be picked up, man. I mean, I'm hardcore and shit, but, excuse me, I'm hardcore and stuff. Don't write that down. But what I'm saying is, you know, people, it be hurting. People thinking, oh, he's so hard. Ooh, Wu-Tang, Wu-Tang. You know, no, it ain't like that, man. Nobody didn't pick me up. I got my hands out like this. Nobody even picked me up. His hands crossed. He don't even want to deal with me. I'm done.
All right, well, we appreciate that. It was very, very informative. Okay, thank you. Thank you. All right, next question. I hear a lot about the mixture between race and class and how being a black man without insurance makes it hard to get health care. So I want to know, how does not having insurance, health insurance that is, get in the way of health care for African American men?
So, say you make $4.50 an hour. It happens. And you get a medical bill because you went to the doctor and your bill is $2,000 to $3,000. How the hell you gonna pay that bill? I mean, they knew that when you got there, you didn't have the money because you checked on the form, I ain't got no damn money. I mean, it don't say that, but, you know, you do it. They know already. So why you sending me this bill? I know the answer. Don't nobody answer it. You want to mess up my credit. But see, the issue is I'm already houseless as it is. So I'm already houseless. So you give me that. Now I can't get a loan for a car. I can't get into my apartment because when they run my name, the computer died. And then I can't get nothing, you know what I'm saying, because of you running my credit and messing up my credit. So to me, that's the biggest issue right there. They get in the way is that money, because all black people on low income. There is. Black men all on low income.
Well, it looks like it's my time to speak. That's not true, son. I'm not low income. I pay all of my bills. I've been gainfully employed for years. I think I was working in my mother's womb, as she says. And I got paid dearly for it. I'm proper. I have my own insurance. I do all the things that I need to do. I handle, as Conscious Rap would say, my business. Yes, I do. So it's not an issue for me when it comes to money. No.
Well,
You all right, man? You had too much sugar? Hey, man, y'all better watch this one. I think it's settling up, man. Come on, man, wake up. For me, it's an issue when it comes to, like, going in there, because at Duke, right? Y'all, anybody in here been in Duke? Let me see your hand. You been in Duke? You been in Duke? All right, let me talk to you, because ain't nobody here go to the doctor. And some of them ain't even black, but they don't go to the doctor. I don't know what to say about that. So I'm going to keep it real with you. So you go to the doctor. When you in the doctor's, you think you about to get your own treatment, right? So the money is in the way, right? So basically what they do is they bring a whole bunch of people in the visit with you. You been like that? At Duke, you been there? So see, they trying to do this thing where they trying to bridge the gap, like open it up between the community. They trying to like keep it real. So they do this survey. And when they do the survey, right, then they want you to talk about how it's going. But see, they more about teaching now. That's the problem with Duke. They think they Duke University instead of Duke Hospital. Cause I'm in there with my butt out, I've been in there 4 hours, it's cold, right? One person walks in, and I ain't gonna lie, they white, so I thought they was the doctor. They wasn't. It was a PA. You know what that means? A pretending ass doctor. Yep. I would have laughed if I had it in me, but I didn't. Because right after PA came in, it was 5 more of them with white coats on. And they all there. And then the real doctor walked in, a black lady. I was shocked. I was like, what you doing? Because I ain't never really been in there, right? This was emergency, whatever. And I come in, and then they come ask me all these questions. I'm like, what happened to the bedside manner? I mean, what's all this? I didn't ask for a party. I mean, I know I'm here for the first time, but that don't mean I need this kind of introduction. So with Duke, I think they just done lost touch with the community. We don't need all them damn people up in there. I don't have patience for that. I'm a patient, but I ain't got patience for that.
All right. Thank you. Miles, we didn't hear from you. Do you have anything that you want to add? We need to tell them it's a sign of weakness not to go to the doctors. Then they will go to the doctors, like in the TGAMS. If you heard of it, the TGAMS. The Tom Joyner Morning Show. I thought we had enough black people to get that. It's a mixed group. But at the TJMS, they say, take a loved one to the doctor day. You can go to the doctors, and then when you go to the doctors, it's free. You don't have to worry about money, conscious rep. You don't have to worry about that. You go right in and they check it yourself. Or you can go down to CARE. They have people there all the time. It's a big medical facility. It's like 3 levels deep. They'll check your blood. They'll let you stick needles in your ears. It's not what you expect, but it's a cornucopia of health insurance on another level. It's beautiful. That's what I would say, man. Nobody don't want to hear that. All that talking ain't gonna get it. See, this is the problem. You can tell them, go to the doctor, go to the doctor, go to the doctor. Man, you can't be walking up on people like that. I don't want nobody up in here to like walk up on somebody black that's a dude and be like, when last time you went to the doctor? Don't do that, because you're gonna get hurt. That's not the approach. You ain't a researcher. You need to be in a room with a whole bunch of chairs and a microphone. Don't do that. No, I would say the real key to it is that you have to be a Superman. You got to tell them you Superman. You got a cape on you. You know what I'm saying? Soldier up. You don't need no doctors. If you hurting, just sit for a minute. Take some Pepto. If you ain't got no Pepto, sit like this. Thinking man position. It look like you thinking. You might be thinking about you hurting, but you really just thinking about, whatever you thinking about, depending on how you look at it in the situation. But then again, when you think about it, it may not be like that. I got that from Raleigh, North Carolina. On Sawyer, I told you I've been in and out of Durham 35 years, but it depends on how you look at it in the situation. But when you think about it again, it ain't really, yeah.
This is the city of medicine, man. It's people's resources all over the place. You can go to the Lincoln Center. It's $20, but some days they have community health screenings. Then you can go and get the community health screening. There ain't even no money on you. And see, back in the day, because I was born at Duke Hospital, and Duke was for black and white people if you had money. If you was broke and you was black or you was white, don't go to Duke. But if you had money, go to Duke. Or if your mama's mama worked at Duke, go to Duke. And then Lincoln Center was only for black people. If you was white or light-skinned, don't go. If it didn't say black on your license, the people at Lincoln was like, we shall not let you in. It was like that. I kid you not. I was there. And so, basically, that kind of hampers them, what you were saying. I heard you when I was asleep, but that's what hampers is the access if you don't have the money. That's all I got to say.
Okay, well, thank you for getting back with us. All right. Okay. Are there any family members whom have been influential to your decision to seek or not to seek medical attention in the past? So you guys can go in any order that you want, and that'll be fine.
I'm still up, so I should just go. They talk too much, so I would say my parents and people that worked at Duke influenced me in the past, but when we're looking at the present, I influence me because I'm the one who's sick.
Well, when I think about it, my parents influenced me. I mean, they all went to the doctor. They all handled their BIZ. So it was pretty easy to do. And, my community, I had so many strong black men in my family. They really influenced me to go to the doctors. It was by example. They didn't have to tell me anything. They were men of valor, important men. Yeah, we got them in our culture. Just got to look for them. For me, I don't like the doctor. I already told you that, but I want to put that on the record. You writing that down again? Thank you. Just put it down. I don't like them. I don't deal with them. Because basically what they do is they kind of they appeal you out. You heard of peeling out? You on pills? Okay, then move, because I don't know. I'm like, you on something. No, you're not. All right, it's cool. You don't have to be on nothing. It's good. You could be normal. Just be sexy. Just be sexy. Just be sexy. Just like you doing. Just keep doing that. So basically, peeling you out means not like peeling you out, right? But it's like they give you a pill. So you can say you in pain, you go to the doctor. Then they give you a pill to ease that pain, right? And so you ease that pain. But for me, the situation get a little deeper because I can't afford the prescription. So I wait for 12 hours in the waiting room. And guess what? They peel me out. And I go down to CVS like, hey, they peeled me out, hook me up. And they like, oh, that's $55 copay. So I don't get peeled out. And it's like they don't trust me because my back situation be hurt because I'm an ex-con. Then they think they want to stereotype me and all this stuff talking about, you going to do some drugs. I'm in pain. Hell, I ain't going to do no drugs. I ain't got no, I'm in the thinking man pose. You need to see, when you see a black man like this, he thinking or he in pain. We got to educate these doctors. Where they get their education at? Don't nobody tell them how to translate body language? Man, no, if you go to care, they don't do that. They know. When I walk in like this, they like, okay, the line start over there. You need to go get some help. Maybe it's like a lot of black people working there and they get me. I don't know. But I appreciate it. My Aunt O.M. is the one that really influenced me because she taught me how to take care of myself. See, one time, it was real cool because I fell off my tricycle and I bust my head on the rock. And it don't sound as bad as it is because my Aunt O.M., she went into the refrigerator. She got a slab of fat back, right? She brought it back. She put it up on the table. She got a big butcher knife. I ain't going to even use that because it's sticky. She cut it, took it, put it on my head. Oh, before she did that, though, she went outside. She got some spider webs. Batman. No, that's the wrong one. Superman. All right. So then she put that in the wound, right? Then she got the fat back. There it is. Bam. All right. Put the fat back on it. Then she got some fabric, tied it on like that. I was like a Teenage Mutant Ninja Turtle. So I was running through the neighborhood like, playing. Week later, it healed miraculously. Didn't need no doctors. Not one stitch. Didn't see nobody. My auntie hooked me up. She taught me how to heal myself. That's why I can take care of myself. I don't need nobody to do it. I can take care of myself. Thank you. All right. Next question. What encourages more black men to seek preventative medical care or treatment for their symptoms?
Pain. Pain will do it. I don't like the feeling of pain. Nope. So that skip I did, that's what I do when I get pain. I don't like being sick. It will make you go to the doctor. Instantly.
Well, I would say pain is a good one. He's right about pain because, see, one time I was hurting so bad that I got in my friend's car, but I had to crawl to it like this. For real, on the concrete. I wasn't even playing. I was crawling to my friend's car, and I got in like, he's like, "You all right?" "Yeah, I got this. Look, I don't need no help." Got in the car, put the seat back. Oh, I was like this. Oh, hell. I was messed up. I couldn't even control myself. So I'm in the car riding, and I was in so much pain. Man, that pain will make you go. I was doubled and went to the doctors, and I tell you, as much as I think I can take care of myself, I wasn't going to put no fat back on my stomach. I was beyond fat back. Wasn't no spider webs going to help me this time. That day, I was the patient, and the doctors were the doctors.
What encourages more Black men to seek preventative health care for their symptoms, okay?
Fear and not knowing. That'll do it every time. Because I don't know what's going to really happen, so I don't run to go. You know what I'm saying? So I be having all this fear up in me about it. And so when I do finally go, I'm thinking they're going to have some bad news for me. Like instantly, I think they're going to have some bad news. Yeah, see, I think the same thing. It's not your turn, man. It's my turn. I think they're going to have some bad news, so I don't really want to go. I don't really want to go to the doctor. And so because I'm so scared, that stopped me from going. And I don't care if I'm bending over in the lack like he was, I'm still not going. And that's the truth. That's the truth for me right there. I'm not going to go. Man, look, I ain't got time. Let me, I got a new story. Sorry, BB. But I went to the doctor one time, and it was something crawling on my body, in my ear. I went to Duke. True story. This ain't no lies. True story, right? Went to Duke. Sat there 12 more hours. That's the magic number at Duke. 12 hours. Everybody here know they didn't sit. They be in the chair like. It's only so many times you could walk through the side door before the security start looking at you. Like, so I went to Duke. I waited 12 hours. I felt something crawling, and I was like, "Oh, something is crawling in my ear." So I went to the doctor. Then 4 hours later, they put me in the back, and then the pretending ass came, and I'm doing like this, and she talking about, I could hear her in the hall.
I think we need to do the call of 5150. He's hurting himself, and maybe he's going crazy. I don't know if he's a patient, and we should give him medication or.
And I'm like, "Man, you need to come in here and check my damn ear, man. Something is wrong. There's something in it that's moving around, man. You don't see it?" So then she's going to look in my ear and go, "Oh, there is something in your ear. I'll be right back. I'm going to go get a real doctor." So I thought she was coming back. Six hours later, no doctor. I got my stuff and bounced. Went home. I'm lying down. I did what my auntie told me. I put some garlic, water, and some other stuff I ain't gonna tell y'all because it's a family secret in my damn ear. And I lied down on it like this. And then at night, I got up and turned on the light. And lo and behold, it was something this damn long on my pillow. I don't even know what it was. It was so crazy. I don't even know what the hell it was. But you know what I felt like doing? Picking it up and taking it back up to Dookie. And saying, "Here's the nothing that was in my damn ear." Yep, that's what I said.
Okay, thank you. Is there anybody else that wants to share anything at all? Luther, we didn't hear much from you. Do you want to add anything?
Yeah, so I would say fear of dying is what gets me because I'll be scared that I'm going to die. So I'll go ahead and go to the doctor. Fear of dying to do it. That'll get you there. That's about it. Now, I got something else to say. So, Medicaid is a joke. I went to the Medicaid office so I can get some Medicaid, because, you know, I didn't feel like going to jail to get a checkup. And no disrespect, I see the beautiful lady from CARE here. I didn't know y'all existed. All right. So, I asked the woman point blank. They so disrespectful at Medicaid. They so disrespectful. I asked her, can I get Medicaid? You know what she told me? If you don't know how to have a baby out your own body, you can't get Medicaid. If you ain't over 68 years old, you can't get Medicaid. That's hella disrespectful. That's all I gotta say. What the hell I'm supposed to do? Pimp? I don't pimp. That's not my hustle. Thank you. All right. BB, it looks like you're waking up and joining us again. You have something to add?
Yeah, I was gonna say a good woman to do it for you. Oh, man, I got this good woman. The black woman is the queen of the universe. Sorry, black women, y'all is, and the white women's are the princess. Like on Mario Brothers when she jumped down the flag. Anyway, the black woman, let me tell you about this woman. I know this is a black men group, but the black woman. Make you walk like your leg ain't broke. How to fix that, stop showing out. But I have a black lady, and her name is Ladybug. I call her Ladybug because she's a lady, and she bugs the hell out of me. Oh, she want me to go to the doctors. And she's so sweet with it. She get her little purple scarf and wave it. You know, she just giving me a scent. Because she put that evening primrose on, and she's sexy. That's that old lady swag. And then she sings the blues to me.
I love you, baby, but you ain't gonna be no fool. I said I love you, baby, but you ain't gonna play no fool. When those doctors tell you to come get that checkup, hey, you better follow their rules. Now, baby, I ain't for you dying on me. So you know what I choose to say to that. Hell to the no. Go get your checkup for mama, baby.
Sugar. Oh, stop that, Ladybug. Oh, sashay, Shantae. Woo! And I do whatever Ladybug tell me to do. Hey, get that leg right real quick, if you know what I mean. Woo! They probably don't know. This is a black men group, so that's between us. Oh, yeah, you know, I tell you, conscious rap, see, we got to feel each other on this, man. We got to keep sharing the stories. Get the word out, pass it down, each one teach one. That's what we got to do. And see, don't scare the young black men by telling them all the bad news. Keep something to yourself. You know, you with your issues, keep it to yourself. Is there something inside your body, like the HIV or the cancer? Don't tell nobody. Keep it to yourself. Don't worry the young people with that. Don't want to hear about your body stinking. Nah.
Man, that's the craziest thing I ever heard. Did you hear anything? We here for medical, man. You need to open up or something, man. But I'm going to tell you something that you just really got me uncomfortable, BB. Talking about feel me. I don't feel nobody. I see men in here looking at me. I want it clear. I don't do that. Don't no man touch me. I don't touch no men. Don't come up over here trying to touch on this. This all man here. Ain't nothing different about it, and I don't like that. Do not put your hands on me. BB gonna introduce that and have somebody get hurt up in here.
I didn't mean nothing bad. You know, the young people say, feel me like you feel me. This is not it.
I think what's going on here is a misunderstanding. Basically, I'll translate. I'll translate. BB was saying that he would like to bridge the gap of communication. He would like to meet you and get an understanding, a general understanding, not to physically touch you, man, whatever. I just know he better not put his hands on me, man. I ain't like that, man. That's why I didn't even want to come here. They talking about medical stuff, to touching people. I ain't got time for that.
Okay, well, there won't be any touching. Okay? It's okay. This is just talk. And just so everyone knows, I don't want anyone to be afraid. I'm glad you're all here and you agreed that there's no touching. This is a verbal speaking. Well, you're using your lips, but it's not. Next question. Thank you, Miles, too, for explaining that. You did a very good job, and I didn't really need the follow-up. Okay. So, this brings us to our next question. And why don't black men go for preventative almost said positions now. My mind's in a whole other place. Preventative procedures like the colonoscopy and the prostate exam. Time for this shit, man. Hi. Would you like to go first?
You go first. I turned around because I don't want to be bothered. This is a sign. This is a international symbol. Leave me alone. Damn, I am here to share. Hey, man, look, all I'm saying is when it comes to being in close proximity to a man, I ain't doing it. You got about 2 inches. You know, this is a safe zone. Go over there by the Kool-Aid. Not right here, right there. See, because my thing is, I don't want nobody getting it twisted about where I'm coming from. See, I don't like nobody touching me. I didn't get touched when I was a kid. I didn't get picked up. Nothing happened for me. And so it's still that way. I don't want nobody putting their hands on me, period. And if somebody put their hands on me, it's going to be a problem. It's going to be a real problem. It's going to be a real problem if somebody put their hands on me. A real problem.
Well, I think I'm going to go stand over here. And, all right. It's a problem. And he got a point. Biblically speaking, the Bible says men's and men's don't belong together. A man touching you in the anus hole is nasty. It's in the scripture. Man not with man, therefore, you touching him is man with man. Now you wonder, can a lady do it? No. Because she's still a man. It's in her name. Whoa, man. They took her rib. His rib, somebody's rib got took. And they put it in her, so she's a man. But a women not supposed to wear pants. It's in the Bible. Just like you ain't supposed to be eating no catfish. It's in the Bible. It's a bottom dweller, eats all the dirt, then you fry it up, talking about, good. It's the scriptures say no booty touching. That's in the Amplified version.
Man, you know what? You make a good point, but I'm gonna be straight up, man. I'm gonna just be honest with you. That's just something that gay dudes like. That ain't nothing that straight men do, man. The prostrate, whatever the hell you said, prostrate. Yeah, that's what you said. The prostrate exam, I ain't getting that colonoscopy. I'm not getting that either. I saw it on Sesame Street, the Ogopokanakis, the big purple thing, you know. And why y'all make the word so damn hard? What it mean anyway? Calling, yeah, that just mean you about to do something. See, my auntie went to the doctor, and she said that she was getting a master mastectomy. When she got to the doctor, they said that they was cutting her breast off. She said, I'm here to get a master mastectomy. And then they said, no, it's a mastectomy, something like that with less M's in it. She said, oh, so you want to cut my breast off? And they said, yeah. And then she was like, you want to cut my titty off? And they said, yeah. And she said, why you didn't say that in the first place? I ain't gonna get that exam. She got her bag and got out of here. You know what I'm saying? If you gonna do something, say the real word. I'm gonna go in your butt and you ain't gonna like it. Well, I've sat here long enough, as quiet as I could. I tried. But you ignorant. 'Cause see, I don't even know where to start with you. I'm a black man. I was born a black gay man. Sometimes it's black men that's effeminine, whatever. That just mean they feminine, but they ain't really getting it down. You feel me? And no, I got this, man. You ain't got to break in.
No, and let me diffuse, because I can see you're cornering him. He'll fight you. The colonoscopy is let me talk to you. It's a thin little skinny wire that they use to go into your large intestine, which isn't up here, it's down here. And they take pictures or they take samples. And the prostate exam, or prostrate, same thing, they're going to the same place, right? Right? All right. I know, safe space, right? That's about Kool-Aid distance. So in that exam, what they're going to do is they're going to put gel on their fingers on a glove, and they're going to insert it and feel if your prostate is hard. It should be rubbery at mouth. Calm down. It's not the exam. It's education. Education. They're going to check, and that's all that it is. I had it done, and it's not that bad.
Man, ain't nobody touching me, man. Y'all don't understand. See, when it comes to my butt, it ain't happening. He done said you ain't gay, you don't have to be gay to get it. I don't care. See, the point is I'm a man. People trying to put me like this, yeah, I'm in the corner because I don't trust none of y'all right now. This started out with some imple questions about a couple of questions from this young lady. You know, she got questions. Now y'all all into the butt detail. Can we switch the subject? Researcher, can you find another question? You got more papers. Find something else to talk about. All I'm saying is I don't want nobody up on me like that. And I'm telling you, when I'm like this, everybody better move. Well, let's try moving. Okay, let's join us back here. All right. Okay. Prostate exam is tough. It's true. It's tough. It's tough.
And the other thing that's tough about it is when the doctors smile afterwards. Don't smile. I mean, I do go and get my exam. Like I said, I had it. It was really easy. They talk me through it. I ask questions. Tell me every move you're going to make before you make it. If you're going to tell me to bend over, tell me where to bend over. Draw an X on the table. That's what the paper's there for a big crayon. Tell me where to go, what you're going to do before you do it. One guy said that he would snap a neck, so they put him to sleep. So conscious rep, there's hope. They can put you to sleep to where you're just kind of in dream mode, and you won't know. You'll think you had a rough bowel movement. So there's hope, brother. So there's hope. That's all I want to say. Thank you. There's always hope. That's right. All right.
No, man, wait, man, I got something to say. He's just going to try to say that. Look, you got to think about Tuskegee. Everybody don't want to talk about Tuskegee. You got to think about Tuskegee. Tuskegee, they gave them people syphilis. And then watched them get all sick. You gotta think about Tuskegee, man. That's how it be. That's how it be.
Well, brother, you're close, but kind of warm and not really. In Tuskegee, the men had syphilis already. And they didn't treat it, but they thought they were being treated. Still a problem, but it's still a little different.
Okay. What about any other thoughts about cultural norms or social beliefs that might prevent men from going to the doctors?
That we Superman. We Superman, and that stops us from going to the doctors because we think we can do it ourselves. And I tell you, we also better than any man on this planet. White men, Asian men, Chinese men, Thai men, Hawaiian men. That's a mixed person, a Taiwanese and Hawaiian. I don't care, any kind of man, we better than all of them. And it's one simple word why we better than them: slavery. We strong. We was bred like this. We go through trouble. We know how to make $1 out of 15 cents. You know what I'm saying? That's black men for you. We the strongest. We don't need nobody to go to no doctor. We could do this. My grandfather pulled a mule behind him right there in Johnston County. When the mule went out, he grabbed in. That's what I'm from. I'm from some good stock. Superman.
Yeah, we are strong. Maybe not the strongest in the world, but we're strong. I don't even know what to say to that.
Well, you don't have to say anything. That's a great part. Everybody is sharing. There's no judgment. And we just go from there, okay?
I would say we die really fast. That's what stops us because we think we're going to die anyway. So we just won't go to the doctor because we just think we're going to die anyway. So, that pretty much does it right there. I would say terrible news. I think I'm about to get terrible news. Like, even when I go to the doctor and I know I'm good, right? As soon as I sit in there, I say, damn, something wrong with me. Oh, man, I'm dying. I got Ebola. I ain't been to Liberia, but I've been to little town over there on Fayetteville Street. It's like Liberia. It's some people in famine over there, man. It's for real in Durham. Food desert, man. It's real. It's Durham. It's food desert is real. Yeah, I would say that. That's really real. That's real. That's real.
You got Ebola? Where you get Ebola from on Fayetteville? He got Ebola. You shouldn't be in here. This is a public gathering. You're going to give it to everybody.
No, he doesn't have Ebola. He was This isn't about Ebola. I know it's in the news, but it's really not about Ebola. This is BB. I'm going to read the question for you one more time. It's not about Ebola. It's really just about cultural norms and preventing men from going to the doctor.
And then the healthcare screenings is what do it. The healthcare screenings. See, they don't think that the healthcare screenings is for the black people. So when we go, we think they're going to Tuskegee us. So we don't go. They want to rub that in my finger and you're going to give me the Tuskegee. But when you go to care, you don't think about Tuskegee and Ebola. Because that's on the other side of Fayetteville. I don't care what she talking about. But when you go to care, they makes you feel like a human. Like you's a real person. When you walk in, they say hi, and they got nice stuff, and it's not glued to the furniture. I even tested it. It's this big vase with feathers in it, and I moved it, just kind of, where the reception man was sitting there, he like a watchdog. But the brother just trying to protect that beautiful sister. It's rough out here for a young man. Anyway, when you go there, they treat you so good. They do the Ricky. They do the Acapulco. That's when they put, you looking confused. I must not say that. My teeth sliding. Acapulco. You know what it is? Now you might think they're going to put needles all over your body. No, they put it in your ears like this, and you sit there. And at first I thought maybe because a black lady on it, I ain't going to lie, that maybe they didn't pay the bill, so that's why it was so dark in there.
I'm sorry, sister. We have a graph. I'm going to put it up. Well, I'm not going to do it, but... Oh, there it is. This thing here is, feast your eyes on that. I have it here, and I'll show the guys. And we have a graph that shows the death rate per 100,000 in the population for a few diseases. The black line that goes across the entire graph near the number 1. You see that? Big black line, okay? And the blue line is for the African American or black males in the time span between 2004 and 2008, okay? And the black line is for Caucasian or white people. And that is in the state of North Carolina. That's their death rate, how often they die, okay? All right, everybody got that part? Okay, and so for instance, in kidney disease here, if you were black, you'd be 2.5 times more likely to die of that than if you were white. And so our question is, how do you react to this? Or how do you interpret it? And what are some solutions for helping black men with health issues? Something like preventative measures that can be taken. And I'd like to start with BB. BB? You okay? Oh, you're up again. Okay, we'll start with you.
Wow. It's kind of hard to look at now. I can see it. But we're in a bad predicament.
Yes, sir. Yes, sir.
I mean, we gotta do better. I thought look at the blue, it's just up in there. I mean, we just ain't taking care of ourselves. This is crazy. You sure this is right? Somebody been playing with crayons? The blue, man, them dead people in North Kakalaka. Office of Minority Health and Health Disparity and Legislative. Yeah, that's real stuff right there. That's real stuff.
Well, when I see it, I see propaganda. I see propaganda.
I see propaganda too. I see propaganda. Oh yeah, there's propaganda on this chart. Anything that an establishment does is propaganda. That's propaganda, and I'll tell you why. The people that was in this, I bet were all from public health departments and clinics. And they're only going to be black people that go there because the white people aren't going to tell you what their issues are. That's why they got this information. It's like the AIDS charts when the disease first came out. They said all gay people only get it. And then they go to the public health department and get this information. It's skewed. It's wrong. It's propaganda.
I mean, I can kind of see what he's talking about, though. I mean, for me, where the propaganda to come in is that it's a line right across the middle, and that's the white line. Why they got to straddle everybody? I mean, why they didn't stand it up right there to go to the one like everybody else? Why they got to be all over the place? And think about it. You got the thick white line for the white people, and then you got all the little white lines, so they everywhere. Everywhere you go, it's white people everywhere, all the way up to the 3. That's propaganda. That's propaganda, though.
That line that's at the number 1, that happens to be black, okay? Those are the statistics that are taken from death records across the state, not specific clinics.
So where are the white people then? The white college kids that get HIV and die. Why aren't they on there?
Well, they are represented there. They're in the 1.
So that's it?
You can just look at the chart a little more. Let's just take a little breather. Just kind of, let it sink in.
Man, you can let it sink in, but what's bothering me, though, is this prostrate. This prostrate ain't hitting me right. Look how big that blue line is, man. It's like the Eiffel Tower or something, man. It's the prostrate. Wait a minute. How you say it?
Prostate. prostate.
All right, yeah, the prostate. It ain't right. The prostate ain't right. It's up there. And, I was against having this at the beginning. You know what I'm saying? But I can't go out like that. I mean, I can't check my own butt. This is crazy. I don't want to be in that number.
I know you don't when the saints come marching in. Oh, I don't want to be in that number.
No, man, I ain't trying to be in that number. Hey, you said they'd give me some gas?
Yes.
What kind of gas?
Good gas that'll put you to sleep.
And so when they give me the gas, they're going to go in my...
And yes, and it'll be pleasant. You won't even know what's happening.
Yeah, I'm going to have to look in the gas. So I just asked the doctor for some gas. Just go up in there. Now I'm going to Lincoln Center. I ain't got $20, but I just go in there and say, I want you to give me some gas so you can check my...
Well, don't use the A word. Remember, prostate.
All right, that's what I tell him.
Okay, thanks. All right, so I guess we'll just move on to the last part. And I just want to know if there's any reflections about how in the Black community we can take this further and you can do more with this information. What is it that you might add to this conversation in the community?
Well, I don't know if I can do anything with this at all. I mean, the graph is bothering me still. It's looming like a dark crowd or a fart. It's propaganda. And it just says that we're going to die first. I mean, the white people don't tell you when they're going to die. They don't take the surveys. So you don't know when they're going to die. They're smart enough not to give up that information. They're smart. They won't give up that information.
Okay. Hey, man, this is what... Miles, have a seat, man. You tired. You went from being all right to just tired. Hey, I know what we gonna do. We gonna motivate people. That's what we gonna do. We gonna go out in the community. I'm gonna take some of these graphics. Can I have these? Oh, sure. Go right ahead. You want one? No, give me the whole stack. I'm gonna take this out in the community, right? And then I'm gonna go down to the D-Pack, because they be having stuff on the grass. So I'm gonna go down to the D-Pack. And then I'm gonna go down to the Bembe Festival. It'll be hella people out in the Bembe Festival. And I'm gonna be handing them out like this, Hey, here, take that right there. You black, there. All right, show that to somebody. That's how you start the conversation. It's the key right here. So I'm gonna go out to the Bembe Festival. I'm gonna go there. I'm gonna go to the health screening. I'm gonna hand this out to everybody. You can't have one. Okay, I'm gonna give you one. You know black people? Good. You know these black people? That's a lot of black people. That's 3. I believe you. Wait a minute, more importantly, do y'all know her? Okay, they know you good. You good. You good. You my sister. We sisters through them. Most of us don't know that we dying of this, man. We don't know. And that blue line is bothering me, man. The blue line is bothering me. We need a billboard. We need to just get it pumped up. I'm ready to do whatever. I'm ready. I'm ready. Thank you. I'm going to ask the guys, y'all want to say anything? BB, what you want to say? You BB Blues? Look, I'm taking over the group. I say that we all just do it in our genre of music. Let's just do it. BB, what you got to say? What you learned from this, man? What you learned from this?
Well, skibble-beebe. That was a warm-up. I would say, if you guys diabetes, don't call it the sugar. Call it what a T-I-E.
That was good, BB. That was good. That was a little bluesy, a little spiritual. And you brought it up from your leg, I can tell. All right, Luther. Yeah, Luther R&B. I would say, your body is your house. So take care of it so it's your home, man. You'll be all right and live past the night. Oh, you grabbing it tight, you better. I got her, man. I ain't seeing nothing but teeth. Yeah. All right, man, that was good. You always trying to go in for the ladies. Hey, Miles, what you got to say?
Well, the Miles jazz, he doesn't really sing. He plays an instrument, so I'll a little skitty-doo-bop-be-doo. Don't let money be. Don't let money be. Don't let the money be the issue when it comes to taking care of you. Just go and don't marry about your credit being messed up. Get your credit messed up so you can check your butt. It doesn't matter because the bills are gonna come when you die. You're gonna get a bill, but you won't be able to pay it anyway. Skip it, beep, doop, pop, that beep, beep, beep. That's all I gotta say.
Thank y'all. So I want to get y'all hyped up because y'all been nice sitting here, doing your thing. So I just want us to stand up and stretch for a minute. If you ain't got no legs, stay down. I ain't going to be like Kanye and be like, why you ain't standing up in your wheelchair? All right, just get out your seat. Y'all rusty as hell. Get up. All right, so this is crowd participation. I'm about to do a little chant. So I'm going to tell y'all what to say and y'all going to say it. You got it? All right, so I'm going to say, buck, say it. I didn't say but, I said buck. Buck. B-U-C-K, bruh. He's saying but. I just got over my butt stuff. Yeah, don't do that to me, bro. It's too much butt for right now. I gotta be asleep. All right, here we go. 1, 2, 3. Go get it. Go get it. Go get it. I ain't gonna never be famous fooling with y'all. I'm gonna do it one more time, then I'm gonna be done. Go get it, 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 go get your checkup. All right, here we go. This y'all big chance. No, but let's change it. Let's say, I'm gonna get my checkup at the last one, all right? And then we done with that. Okay, here we go. Go get it, go get it, go get it. Well, at least y'all know we gotta get a checkup. That's the end of that. Thank you.
For those of you who can stay, we had these panelists that were nice enough to come and spend their time with us. So I'd like to invite them on stage and just get their opinion, get some of their thoughts, because they do work in this community, they do work on these issues, and I would like to get sort of their reactions to what they heard tonight. And we'll probably just keep it to that, because Anita was fabulous in what she does. And so I'd like to invite to the stage Mr. Eric Ireland. He's the Deputy Public Health Director for the Durham County Department of Public Health. He's served since November of 2010. He has been in public health for many, many years. And so Mr. Ireland will come on up here. And also Dr. Nadine Barrett. She's a medical sociologist who directs the Office of Health Equity at the Duke Cancer Institute. Prior to joining Duke University Health System, she was at the Susan G. Komen for the Cure Global Headquarters. And she, too, is working across the continuum of care on health disparities research. And so I'm going to give the mic to them. I'm going to give it to Mr. Ireland first.
Thank you. Good evening. I hope everyone enjoyed the performance. Yes.
Can we have Anita come on back out here, too? Come on.
She did an excellent job. Thank you very much.
Thank you. Thanks.
Very enlightening. The characters brought out a lot of things that we need to take heed to. But the one thing I want to impress upon everybody is that making a change and making a difference in the health and lives of African American men really just needs to start with a conversation about what the possibilities are, about the resources that are available, and there are resources out there, about changing attitudes, changing learned behavior. Some of the things that a lot of us experience as men are learned behaviors that we learn and we mimic from the men that we see around us. For myself, women were the major influence in my life, and I had a lot of women around me that were going to make sure that I went to the doctor, and continue to do that to this day because of their influence. But again, it starts with a conversation.
First of all, thank you for having me here. And most importantly, I think it's really mind-blowing. It's great to see Anita in a whole different space from what we're used to seeing her in with breast cancer. But I have to say, basically echoing what Eric has said here, that I think one of the biggest things is that we have events like this quite often, not quite like this, which is actually new. And so my hat's off to FHI 360 for making this happen and for the focus groups. I'm always a big advocate of focus groups, and that's something that we've been doing at Duke more and more as well, just to figure out how can we better serve our community. And the best way we could ever serve our community is exactly by this, listening to the voices of our community and then working toward changing it. And so it's so easy for any of us to come together here and be entertained and be blown away by what we're hearing. And what was most powerful to me as a Black woman in this community is being able to see that what we're laughing at resembles what we see. It's what we know. That's why we find it funny, because we see ourselves in it. We see our family in it. We see the men that we know that's in it. We see the providers that are in it. So I think that what we need to do now is think about, as a collective group, how do we take this information, take what we've learned, take what we know, and then move it toward changing the rest of this world and changing our outcomes. My hat's off to CARE and to all the other groups that were highlighted in this. I think one of the things that really is important is how we have to collaborate as health organizations toward making sure that we're addressing healthcare in a very collective and cohesive and comprehensive way. And I think last but not least, for those of us who are not necessarily in the healthcare system providing direct services, I would say to each and every one of us, whether you're a lay person that's working in your community, you're at home, or you're going to your churches or wherever, what do we need to start doing to support our brothers? What do we need to start doing to really raise awareness? And I think a big part of that is when we have our little young sons and young kids, and as they're growing up, and we turn around to them, and when that little boy falls down, we're like, get up, honey. It's all right. Suck it up. Suck it up. Don't talk. Don't cry. Don't cry. Just stand up and suck it up. But then when that little girl falls, we're like, oh, baby, that must hurt so bad. Oh, my, come here. Oh, no. So it's almost like at a very early age, we're already teaching boys to not respond to their health issues. And we're teaching girls at a very early age to go ahead and show all your feelings that you have. And then we wonder why, as we grow up as adults in the Black community, and for any community for that matter, why we can't understand why men are not engaging with the health system and addressing their health, and the character that you showed that didn't want to show the pain, because we're teaching these young boys that at this high. So I guess my only advocate on point to all of this is to say, one, as healthcare providers in different ways, let's continue to collaborate and let's dig deeper, not just do the surface things, but really think about what does it mean to be not culturally competent, but culturally humble as providers, so we can really start thinking about what are our biases so we can effectively support our community in an effective way. And for those of us within our community, again, think about how we can start working toward addressing change in our own backyard. It starts with ourselves, with our family, and then we take it out from there into our social networks, whether it be our churches, our community organizations, etc. And then it goes from there into making sure that when you do show up at that doctor's office, you advocate for yourself and you advocate for your loved ones. And that means it will take preparation. And now I feel like when we're leaving here, we've been informed. And so now what do we do? How do we now take action with what we've learned today, and how do we move that work forward? So those are my thoughts on that, but thank you.
I would say, for me, I would suggest that people listen. When I started this project, I was told that a lot of the Black men don't go out and they don't speak to people. But I'm one of those people where it looks like I have cheesecloths over my face because everybody tells me all their business. I don't care where I'm at. I could be shopping and the lady's like, oh, my butt hurts. I'm like, really? Nice. So I have that privilege to take in so much information, in particular with Black men feeling extremely comfortable with me. And I think it's because I grew up with all brothers, maybe not. But to be able to listen to them is great. And then also for Black men, encouraging them to use their voices. And we can do that in every day when they're in a restaurant and they want to say something, but they're scared of scaring somebody. If you've been around Black men and they might be like, I don't want to be, like a Black man, or I don't want to scare nobody. And I'm like, brother, if you don't come out that shell, you might napalm a couple of people the first time, but because you're just using that muscle. But we have to empower them to use their voices. So that's what I learned in this process, that if we empower them and give them the space to share, we can learn so much. They have so much to offer to us.
Excellent.
Thank you to all three of you, especially you, Anita. A fabulous job working with a ton of data, and you didn't even realize it was data, did you? It was just entertainment. So thank you again to all of you. We do have a raffle. If you want to come up and draw the raffle that was out front earlier. And then after that, Anita's going to be out in the lobby for a little while signing autographs if you would like to head out there. So we'll do this raffle drawing and we'll call it a night. And thank you so much for all of you for coming out. We hope you enjoyed it.
Thank you.